Hello, listeners. A warm welcome to Views on Health. A great pleasure to have with me on the program tonight Dr. Dulangi Dahanayake, consultant child and adolescent psychiatrist, senior lecturer in psychiatry at the Faculty of Medicine, University of Colombo. And as Dr. Dulangi Dahanayake's designation will denote, the focus will be on psychiatric issues pertaining to children and adolescents. Warm welcome, Doctor, to the studios.
Thank you.
And for the information of our listeners, we are going to discuss sex education. So let's have this discussion very freely in the interest of our listening public. Over to you, Doctor, to introduce sex education.
Okay, thank you. I think sex education is something that we as a society is very much reluctant to talk about, but its importance is such that for every child it's so valuable that we impart this knowledge. But then when we refer to sex education, it's really controversial in our society because everyone thinks we might be abusing our children, we might be offering them information that is not suitable. Of course, that can happen, but that's a process. So it all depends on how we go about sex education. So I think something that I have learned when chatting with parents is that they feel that sex education is talking to our children about the sexual activities and behaviors rather than all the other processes that should be encompassed under this theme. So that's what I want to highlight tonight because I want to talk about why it's important for our kids to understand our bodies because we are all sexual beings. So one of the prime things that we do in life is that we go for reproduction. We have to make sure that our species is propagated. So sex education is a part and parcel of all our lives. And it has to start at a very early age. We can't suddenly go and talk to our children about sex. So I think one thing that we have to highlight here is that it has to start as early as possible.
Thank you for that introduction, Doctor. It's interesting, yes, because Sri Lanka being I would say, a part of Asia or Southeast Asia, and we have been very conservative in these aspects, and people don't talk about this freely within their families or in their social circles where children are concerned. I'm saying, so as a result, we have seen many children going astray because for lack of knowledge to begin with.
Yeah.
And the fact that they don't know how to take care of themselves. Having said that, you're the expert. So when you say it has to begin at a very early age, how early would you say you should impart this knowledge? Given, I think I would say in degrees, in varying degrees. It's not the same thing straight away, but step by step. What age should you start advising children on sex per se? And the education that comes with it, because that'll really, I would think, be a guard, a buffer, a protective cloak for them as they venture out into this world.
Yeah, definitely, because otherwise they will get information from all sorts of other sources, because nowadays kids have access to the internet, social media, so they get all sorts of information. So it's important that we start it at home, so that they can always come back to us and see whether the information that they have obtained is correct or whether there are difficulties they are experiencing. So I believe that when I said it has to start as early as possible, it actually starts around 1.5 to 2 years, because that is when kids start identifying their body parts. So it's all a process. So children learn about their body parts when they're about 18 months to 2 years. And by that time, they are able to point out and tell which body part this is. So it's important that we give relevant names to the body parts, because sometimes out of shyness, parents may not want to refer to the genitalia using common names or names that we use when we are dealing with kids. So I think it's important that we start at that stage. And then, of course, by around the age 3 years, children are able to differentiate between girls and boys. So especially if they have a sibling of the opposite sex, they would definitely get exposed to the different body looks and how they pass urine and all those things. So then kids become curious and they ask questions. So it's if we are too shy to answer them at that stage, and if we shut them down saying, or if we outright lie to them, because sometimes that's what we do when we feel embarrassed, then we sort of sever that bond, that open dialogue that we could build from a very early age. So if children do ask, of course, sometimes they may ask questions at embarrassing places, when in public they may ask things very loudly. But it's important that we listen to them and we help them understand at an early age. But it has to also be age appropriate. So we can't give all this information at once. It has to come over the years. So that's why we have to start early when they name their body parts, when they identify themselves as being boys or girls, and then around 4 years they start playing, conforming to the gender norms, dressing, playing in different ways. And then at that age, we can start to talk to them a bit about safety also when they are preschoolers. So they are able to understand their body parts, like identify. So we can tell them about private parts. So that's, I think, one of the first places where we have to address safety. So we can talk to them about places that other people should not touch and places that are private to them, like their chests and what we generally refer is the area between your legs and your backside. So then children are able to understand. And we have to also tell them if they feel someone tries to touch them or if they feel uncomfortable with someone, to run off and tell a trusted adult. So we can do that with the preschoolers. That is where it has to all start. Otherwise, we can't suddenly teach them when they are 10 years or 12 years or after something untoward happens. So I think that's where we have to make that initial background for sex education.
Thank you, Doctor. You laid the foundation, I think. And when you say preschool, yes, because preschools are common to both boys and girls. There's no segregation. It's when they get a little going to the primary school, that either if they go to certain schools that have co-education or other schools are segregated, it's girls only and boys only.
Yeah.
So at that point, in the preschool, I think is a good starting point. I'm just wondering, Doctor, I'm not, don't know if it's a fair question to ask you, but when you speak of preschools, we have hundreds of thousands of preschools in the country.
Yeah.
And would you say that most of them are kind of geared for this type of sort of exercise in telling the children, advising the children, because preschools are confined to certain activities, and then of course there's playtime, and then there's like meal time, and so I'm not sure whether this, is incorporated into the system, because it's a need now.
Yeah, it's definitely a need, but I also agree with you. I don't think it's incorporated into the system of the majority of the preschools that are there, especially because our institutions are very, I would say, shy and concerned when they try to approach this topic, and they are scared of the backlash that they might receive, because some parents may not want the kids to be educated about these aspects. But of course, we can always get parental consent before going for this sort of program, even at preschool level. So if the parent feels that they do not want to expose their child to this, we can give them the choice of opting out of this sort of educational sessions. But it's something we need to incorporate into our preschool education system. But unfortunately, I agree that it's still not something that's there in the majority.
Doctor, another question is, when you speak of teaching the children about their chest and their private parts and all of that, and to be careful and like not to allow anyone to touch, or if somebody does touch and if they're not comfortable, to inform an adult, maybe the teacher in the school or the parents in the house when they get back home. Now, in that situation, would you think that if it does happen to a child, where somebody does touch, I'm talking about the 1.5 to 2 years, would that have an impact on their minds?
Yeah, it could. Because one thing is we have seen very young kids presenting with what we call sexualized behaviors after these sort of unfortunate incidents of touching and fondling, because they get some pleasure out of those. Even the very young kids, because our bodies are designed to receive pleasure from these activities, and then kids may start doing it to themselves, or they may start touching others because they think that's acceptable behavior. So there could be a lot of behavioral issues. And if they have felt threatened or uncomfortable when this happened, even if they cannot recall, their trauma memories would still be there and impact on how they interact even in adult life. So even the earliest exposure to this sort of unfortunate incidents will definitely have a lasting impact on their development.
Thank you, doctor. So going on from there, when you go from 1.5 to 2 years and you give that very, very basic of, identifying, parts of their body that should be protected, what's the next step?
Yeah, so in the preschool, like I mentioned, we can talk about the private parts. And then in the primary years, there is, we have to focus on privacy and keeping our bodies safe. And then kids also develop a lot of curiosity about childbirths, where children come from. So we can describe, without going into details about the anatomical and mechanical aspects, we can tell kids that, when two people are together and when they love each other, that a child would come to the mother's tummy, and then the child could be delivered, and then they grow up and then they become parents. So we can describe a bit of those life cycles. And even sometimes if you have pets at home, kids may see what's happening. So we need to talk to them. We cannot sort of shut them down if they are curious and ask questions, because if we do, then they will definitely go to someone else with their questions. And we do see a lot of preschoolers now with sexualized behaviors and issues because they have been abused. So again, it's important to continue to educate them about keeping themselves safe. And then of course we go to the teenage years, the tougher times. There, I think something that we have to start talking to the 10, 11-year-olds is how their bodies are going to change. Because sometimes they become frightened when they feel that their bodies are growing, or when they feel that their breasts are growing. So we have to talk to them about the changes, what happens in a girl and what happens in a boy, so that they are better prepared. And they know that these things will happen and it's natural and it's part of growing up. So we shouldn't sort of give it a special label and make it some, mysterious event. We have to tell them what it is all about. And then I think another thing around, of course, at schools also we teach them about sexual activity and all around 12 to 13 years. And there the kids get to know about this information. But I think something that we don't generally do is we don't give them an opportunity to clarify any concerns or doubts they might have. So that's an opportunity we should give our kids. And we have to, like I said, again and again, listen to them, clarify their doubts and concerns. And we have to also talk to them about, again, safety and also about healthy relationships, because when they're teenagers, nowadays kids do get into relationships, intimate relationships. And we have to talk to them about respect, about choice, about assertive skills, because they have to be assertive. Otherwise, sometimes kids feel compelled to give in to their partner's wishes and do things that they don't really want to do. So we have to help them learn about their bodies and be more comfortable and more confident in saying no. Another thing that teenagers experience now is all these social media and the whole fiasco surrounding social media. So we have had situations where kids have gotten into relationships on social media. They aren't even sure about the age of the partner because they have never really met. And then they have behaved in risky manners, sending photos and having sexting. So I think these are also things we need to talk to kids about. And especially our teenagers need to know how to keep themselves safe, that it's not safe out there with social media. And sometimes they turn to those because they feel there is a lack in the emotional relationship that they share with their parents and siblings. So we need to try and spend as much time as possible with them. Of course, teenagers will not really accept parents coming in and trying to take up their time, but if they feel that we are there for them, I think they will feel more comfortable.
In fact, Doctor, if the point that you made that teenagers may not want their parents to come into whatever they are doing, but if there's that relationship from a very early stage in their lives, and then that builds confidence, and they know that I can always go back to my mother, my father, maybe an older sibling, maybe a grandparent, because it's there at the back of their minds that they have been there for us, they've been advising us, they've been telling us, and we've been good so far. So if we have an issue, we can comfortably go back to them. So I think that is important. But also, Doctor, in today's lifestyle, I'm speaking for our country, Sri Lanka. I mean, most parents go to work and they are occupied with some sort of, vocation, some of them. So it's very few who actually total mothers, meaning housewives and mothers. Maybe they can give more of their time, obviously, but otherwise it's a factor to factor it in the midst of their work and other commitments, and then the children's studies. They have tuition, they have extracurricular activities, sports activities. So time has to be sort of put aside for this exercise. What sort of advice would you give parents in this regard?
Yeah, I think parents need to make that time. I know we are all very busy because most of the time both parents are now working and the grandparents may not be around. We don't have the luxury of extended families as we did maybe a couple of decades ago, but still it's important to make time. So I think one thing is we have to get our priorities straight, because everything else will happen, but for our kids there's no one else. So we have to try and make that time. If you can just go down, list down the things you do in a day, I'm sure you would be able to find 15 to 30 minutes to spend with your child. We all do meaningless stuff. If you go on, searching the internet, you 1 hour may be lost without you even realizing it. So we have to make that time. And we have to make sure that our kids are able to open up with us, because that, again, like you mentioned, has to start at a very early stage. Because if we shut them down when they try to approach us at a younger age, then we can't suddenly make them open up when they're teenagers. It's a process. And it's challenging. It's not easy dealing with a teenager, their moods, and they will also be wanting to do what they want. But we will need to negotiate and work with them. And one other thing that I want to highlight is that as parents, we have to also set an example from our relationships about mutual respect, safety, and having a good time within a relationship, so that our kids have a good template to fall back on and see what a relationship should be like. Because otherwise they may have a very have a different idea of what a safe relationship would be like, and what the partners would get from a relationship. So it's important that we as parents try to improve our own intimate relationship, so that our kids can see something that is that is a good example for them to build up on. And then, of course, going from that, parents also need to educate themselves about what's happening, what sort of things are going on, how to talk to their kids about this sort of difficult topics, because sometimes our parents may not have spoken to us about sex and all these stuff. But like you mentioned, it has now become very important because of all this information that is accessible for our kids. And then that is why it's our duty to learn about this stuff and be ready when our kids come to us with their questions and doubts.
It's a very good point that you brought up, Doctor, on adults and their relationships, because the children see what they see in the house and maybe within their social circle. So, of give and take, there may be odd instances of issues, but that's a different matter. But on a regular basis, it's the mutual respect that husbands have for their wives and vice versa. And that will be, a good grounding for the children to know that this is how my parents behave and this is how things should be, the right way. I'm happy you brought that up, Doctor, because we do see a lot of, trauma amongst adults too that can impact on children. And so time is catching up with us, unfortunately. But can I just ask you to highlight a few examples or instances in your practice, in your, as that you can share with our listeners, instances that have happened and how they have been overcome, or rather how they are addressed to help them to overcome?
Yeah, so we have had, because we are a psychiatric service, we do get patients or children mainly after incidents happen. So because of that, we will have certain challenges. For example, we have seen children after they have had been unfortunately sexually abused. And we have seen some kids who have been very assertive, who have, even at the most initial stages, decided that this is not a good thing that's happening to me, and they have gone back and gotten the help necessary. But then we have also seen children who have not been even aware that they were being abused until this is taught in school when they are 12, 13. And then they realize that what happened to them when they were 6, 7 was not right. And then they come with a lot of emotional issues because they realize that something really bad has happened to them. So that's why we have to start early and let them know about these private parts and safety and feeling secure, all that, because otherwise they may come at a much later stage realizing that something bad happened to them before. So we can prevent that sort of unfortunate incidents from continuing. Because sometimes it has continued because the kids did not have the knowledge to know that it was bad, and they didn't have the skills. They weren't assertive enough to stop it.
You're talking about boys and girls, both?
Yeah, definitely both. Because I think another thing that it's good that you brought that up, because we usually focus on the girls in our culture. We are worried about their losing. Yeah, we are worried that they will lose their virginity. That I think that's a whole different topic, of course. But then we are more protective of our girls. But unfortunately, we are seeing a much higher number of boys nowadays than before, coming with sexual abuse and all sorts of emotional, behavioral problems, not doing well in school, and also behaving in a very inappropriate manner, because sometimes they don't understand that what was done to them is wrong, and then they go and do the same to other kids. So peer sexual abuse is also something that is coming up. So we have to be mindful about our boys as well, not just the girls, but definitely both parties need our input.
Thank you so much, Doctor. Like I said, time has caught up with us. So what is your take-home message?
Yeah, so the most important thing is that we start early and that we are available for our children, because then we'll be able to continue that relationship, we'll be able to support them, and we'll be able to empower them.
Thank you, Doctor. That was a very short and I would say an appropriate message, apt message at this point in time. And I sincerely hope that our listeners, our listening audience would have taken note of the discussion that took place today on the program and the way to go where this is concerned from the expert, Dr. Dulangi Dahanayake. Thank you so much, Doctor. And we look forward to your presence on the program next week too, time permitting, because you have a busy schedule as a practicing child and adolescent psychiatrist as well as lecturing at the Faculty of Medicine. So we hope you can find the time to be with us next week too on the program, because I love to continue with advise our listeners to take note of protecting their children in this current context. Thank you so much, Doctor.
Thank you. Good night.
So we place on record our grateful thanks to Dr. Dulangi Dahanayake, consultant, child and adolescent psychiatrist, and senior lecturer in psychiatry, Faculty of Medicine, University of Colombo, for being with us on the program. Thanks so much, Doctor. My thanks go to Damayanti Columbage for technical assistance. I'm Fatima Razi Kada saying good night and looking forward to your company next Monday, same time on Views on Health.